it's a common problem across countries in Africa. Thank you.
All right, thank you for your response. We are moving forward with our program in the interest of our time. Dr. Mashumba.
Dede would be introducing our guest of honor, sorry.
Right, good morning once again. It's my pleasure and honor to introduce our guest speaker today. This is none other than Dr. Simon Nyadundu. He's the Chief Director, Human Resources and Admin at Head Office. He's a former PMD, Manicaland and Midlands. He's been a medical superintendent at Victoria Shtepo Provincial Hospital. He was once a district medical officer for Mutare, and he's a public health specialist. Dr. Nyadundu, thank you.
Thank you very much, Dr. Mtede Masanga. May I start by introducing the one who has sent me here. Let me take this opportunity to introduce our incoming Permanent Secretary, Dr. Aspect J.V. Maunganidze, who is a general surgeon specialist by profession. He has worked within the Zimbabwean health system, housemanship, Parirenyatwa, and Salim Gabe. Then he also worked there. Then afterwards he worked for the University of Zimbabwe as a lecturer and providing vital teaching to the students. Then after that, he was appointed the clinical director for Salim Gabe. Then after that, he was the acting chief medical officer for Salim Gabe. I think for those who know, there was a time when the ministry changed from chief executive officers to chief medical officer, so that that post can only be held by a medical practitioner. He was a member of the Medical and Dental Practitioner Council of Zimbabwe. He has been a member of ZIMA, serving in the ZIMA Council of Affiliated Associations. So on the 5th of October, he was duly appointed Secretary for Health and Child Care for Ministry of Health. So I will now move on to read his speech to this august gathering. Director of Ceremonies, Dr. Mashumba, the Medical Superintendent for Victoria Shtepo, Dr. Masanga Mtede, the President of Zimbabwe Society of Obstetricians and Gynecologists, Dr. Tsitsi Magure, the President of the Pediatric Association of Zimbabwe, Dr. Wedu Debele, and all your executive members and the membership at large, the ZIMA, Zimbabwe Medical Association Secretary General, Dr. Mateweke, the presidents and council members of the invited professional associations here present, the distinguished presenters, researchers, academia who are here present, some of who are also my teachers. I duly recognize you. The partners, sponsors, collaborators, and exhibitors who are here, I recognize you. May I also recognize Dr. Lucia Gondongwe, who is the Deputy Director for Reproductive Health in the Ministry of Health and Child Care, and all the staff from the Ministry of Health and Child Care who are here present, the Secretariat and service providers to this very important gathering, ladies and gentlemen. It is my privilege and honor to be guest of honor amongst the stewards and gatekeepers of our future generations. There is an African saying which says, if you want to go fast, go alone, but if you want to go far, go with others. So in that respect, may I at this point thank and commend the Pediatric Association of Zimbabwe PAS and the Zimbabwe Society of Obstetricians and Gynecologists leadership for this synergy which you have done in hosting this meeting. So that means we will go very far in terms of achieving the objectives and the mandates which we are supposed to deliver. The Ministry of Health and Childcare would like to thank the members of PAS and ZSOG for the unwavering technical support that we have provided steadily over the years from generation to generation in your various capacities. With your active participation, reproductive, maternal, newborn, child and adolescent health national guidelines, protocols and training curriculum have been developed, written and reviewed regularly. You have availed yourselves to help in establishing a competent health workforce in your sectors through facilitating trainings in several areas, including emergency, obstetric and neonatal care, IMOC, integrated management of childhood illnesses, emergency trial and treatment, ITAT, prevention of mother-to-child transmission, just to mention a few. You have led research in various areas of national interest within your spheres of influence and contributed significantly to policy formulation. The pediatric and obstetric and gynecology departments have been strong pillars in both nations' undergraduate and postgraduate training programs. Some of us still here with a mix of relevance, nostalgia, and perhaps a bit of trepidation, the voices of our mentors echoing, children are not like adults. I would like to specifically acknowledge and express gratitude for the technical support that has been rendered directly by your members to my office as chair of National Maternal and Perinatal Death Surveillance and Response Steering Committee since its establishment in 2016. As we have heard from WHO in the keynote address and from the just ended panel discussion that followed, professional societies and you as professions have a pivotal role in the implementation of MPDSR, and I do call upon all of you to fully participate so that we achieve its mandate. Your unwavering commitment, along with the collaborative efforts of the rest of the health workforce, the government, and our partners, have yielded positive results, particularly regarding maternal mortality. I'm sure you are all aware that our maternal mortality rate has declined steadily over the years, according to the reproductive age mortality surveys dubbed the Zimbabwean Maternal and Perinatal Mortality Studies of 2007, 2008, and 2018-2019. The MMR declined from 657 per 100,000 live birth to 217 per 100,000 live birth respectively. This decline is corroborated by multiple indicator cluster surveys mix, which showed a reduction from 614 per 100,000 live birth mix 2014 to 462 per 100,000 live birth mix 2019. While we acknowledge that the figure is still unacceptably high, the decline is commendable and evidence of collaborative efforts of the various stakeholders. Sadly, the same cannot be said for our newborn mortality, which has remained unacceptably high and increased from 29 to 32 per 1,000 live birth, according to the mix 2014 and 2019, respectively. However, I am glad to report that with your technical support and participation, we have taken significant steps to rectify that and ensure that our newborns, the future of the nation, not only survive but thrive and live to transform their communities and the nation. In 2020, PAS and the ZSOG, together with your colleagues, the Zimbabwe Confederation of Midwives and Public Health Physicians, collaborated with Ministry of Health and Childcare in partnership with UNICEF and other partners to host the Perinatal Priorities Symposium. This culminated in the development of the Zimbabwe Every Newborn Action Plan, ZENAP, which the Ministry of Health launched last month. Therefore, your joint congress could not have come at a more opportune time, as we have a key role to play in the implementation of ZENAP. I understand your collaboration with UNICEF together with us to make the Every Newborn Action Plan was part of your pre-Congress workshop. We hope that as we continue to join hands, hearts and hands in implementation of this plan, we will see an improvement in our newborn outcomes as in the not too distant future when we conduct subsequent surveys. Hence, I would like to commend you for taking the lead in your joint call to improve maternal and perinatal outcomes through innovative evidence-based practices. As I went through the program, I was really impressed to see that there is a lot which we are going to discuss, which is very important. And the just ended sessions have really demonstrated that. My remarks, ladies and gentlemen, will be incomplete if I don't talk about the need of all medical practitioners to be professional and ethical as we deliver our mandate. Lately, we have seen an increase in the number of public concerns and complaints on the way we do business. Let us be accountable to each other as professionals, to our communities, to our patients, and to the profession at large. As practitioners, we need to continuously look for sustainable evidence so that we offer services which are sustainable to our communities. The world is increasingly becoming a seamless village, particularly with the increase in the number of international flights, which are now touching our domestic and international terminals, the issue of the digital health, which is coming in. It is really important for us as practitioners to analyze and see how innovative we can be so that we remain significant and valuable to the communities which we serve. Let me acknowledge all the partners, sponsors, collaborators, presenters, and delegates who have responded to this joint call to attend this Congress. As the Line Ministry, we strongly encourage these collaborations as we endeavor to leave no one and no part of the country behind in line with the dictates of the National Development Strategy 1. This way, we will collectively contribute towards improving our maternal and perinatal outcomes and the health outcomes in general. As I conclude, ladies and gentlemen, wellness is now a key issue for all of us. Let's endeavor to take care of ourselves and our colleagues as we take care of the others. The ministry is deeply concerned by the number of practitioners who have succumbed to conditions which could have been preventable, and a number who are now requiring care within our various institutions for things which we could have prevented if we have taken wellness seriously. Your choice of venue, ladies and gentlemen, presents a perfect setting to relax. While you are here, please make time to enjoy the majestic Eastern Highlands. I understand there will be a fun run. Please feel free to include mountain climbing and skywalk. Nyangani Mountain Summit is just nearby. The beautiful views and Mtarazi Falls await you. I thank you.
Another round of applause for Dr. Nyadundu. And of course, for Mr. Aspect Maunga needs in absentia, a round of applause for him. Right. Ladies and gentlemen, we have come to the end of our very first session. You know that we don't ask the guest of honor any questions. So if you have questions for him, you can keep them in your heart. Some people would have wanted to ask some questions regarding the panel discussion that we had. And I think we didn't do justice to you because we didn't have time. So if you have questions that you really need to ask, maybe just write them down and drop them by Violet's desk, and then we will take a look at them and find a way of having them answered. Can I ask Dr. Ndebele to escort of our guest of honor for tea now, and then everybody else can follow You'll be with us for another exciting event just after tea, so let's just make it quick and be back here maybe in the next 15 minutes. Thank you.